कदम भरे दूसरों के जैसे पहले खुद को जय करे, हमको मन की शक्ति देना। मुश्किलें पड़े तो हम पर इतना कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला रहे, बदी से ना डरे, दूसरों के जैसे पहले खुद को जय करे, हमको मन की शक्ति देना।
Good morning, all. We are giving tribute to our master Samuel Hahnemann, who made us this science and taught us dare to be wise, seeking blessings from our Guru, Dr. Prafull Vijayakar sir, bridging the homeopathic science with the modern science and made homeopathy easy with mathematical certainty. Jai Hahnemann, Jai Homeopathy, Om Vijayakaraya Namah. So friends, we are in the journey of reading Organon with the theory of separations. So as far as we have read up till now the 13 aphorism from the 6th edition of Organon of Medicine. So today we are reading the aphorism number 14. So in the interior of the man, see, you have to read aphorism in a certain form because the German people write something in a negative way, but it is something you have to take into consider as a positive. That is what you have to understand the aphorism. So in the interior of the man, I skip certain word because when there is a negative, you have negative become positive. When you apply the mathematical science that negative plus negative is equal to positive. So same way it is written in this way that in the interior of the man there is morbid, that is curable, and invisible morbid alteration, that is curable, which make itself known to the accurately observing physician by means of morbid sign and symptoms. See what we have skipped certain words, nothing, no, and not. Okay, this is what very important to understand the aphorism. An arrangement in a perfect conformity with the infinite goodness of the all wise preserver of the human life. So this is what in the interior of the man there is morbid, that is curable, invisible morbid alterations, that is also curable, which makes itself known to the accurately observing physician by means of morbid sign and symptom. So whenever we came across any disease, that disease is represented outwardly in the form of sign and symptoms, which is morbid. That means the internal derangement. But it is something that derange internally. So right now we have correlate this science with the German new medicines with the theory of conflict. That means if we found something at the level of physics, we have to correlate that at the psyche something is going on, a person having some conflict. So you have to do this. This is what accurately observing by the physician for infinite goodness and preservation of the human life. Aphorism number 15. So the affections of morbidly deranged spirit, like dynamis, that animates our body in an invisible interior, and totality of outwardly cognizable symptoms produced by it in an organism and representing the existing melody constitute a whole. They are one and the same. So that means we have divided these things, mind and body, in a two separate entity, but it is for the sake of our easy understanding. But what Master Hahnemann is telling is there is a morbidly derangement vital force which animates the body and which represent outwardly cognizable. That means our intelligence understand certain symptoms which is produced by the organism and presenting the melody, which is the whole as a constitute. So the organism indeed the material instrument of the life, that means the body, but it is not conceivable without the animation imparted to it by the instinctively perceiving and regulating the dynamics that we call as a vital force. Consequently, these two together constitute a unity. See, this is nothing else. This is whole as a whole. So, in same way, we have understood the genetic constitutional simillimum. That means we have divided genetic constitutional simillimum into three categories by the genes. That is a physical aspect, that is a mental aspect, and that is a general aspect. But these all are nothing but the one unity, one unit. Consequently, these two together constitute a unity, although in thoughts, our mind separate this unity into two distinct conceptions, mental conceptions, physical conceptions, for the sake of easy understanding. This is very important aspect of understanding this aphorism. Now, we are dealing with the theory of separation. So up till now we have learned a lot of chapter from theory of separations, and since a few days we are understanding the cases according to this what Sir has thought. So in theory of separation we have learned about the layers, the disease travel from the ectoderm, endoderm, mesoderm, organ of mesoderm, endocrine system to the neuroectoderm and finally to the genetic code. And when in the follow-up our remedy is right, constitutional, genetic constitutional, then the disease has been recovered from the seventh layer to the first layer. Okay, so we'll go back to the our topic of theory of separations. So yesterday we have one of the case of hypothyroidism. Now, today, another case, we are reading this and understanding what it could be. So, the case of Miss NS, age 18 years, having complained of primary epilepsy since last 3 years, manifest in the form of sudden fall, and she was on a treatment of Tegretol 200 since 3 years. So sudden fall occurs with a blanking out for the 10 to 15 minutes. It occurs anywhere, anytime, whether at home, at college, or on a road, etc. Luckily, she had not got anyone while driving. This is followed by an uncontrolled sleep for 12 to 14 hours. Feels weak, tired, and confused after the attack. So this was the presenting complaint of a 18 years girl having a epilepsy. Past history, she suffered from the migraine, which aggravated from the smell of perfume up to the age of 14 years, treated with the allopathic medicines, after which this attack started. This was the past history about herself, her life. So she is a very lively girl who loves to freak out, loves music, playing music, music Casio, loves enjoyment of all sort, loves to go to the movie, to the discotheque, to the hotel, has many friends. She is last affected or bothered about her problem. She goes out driving her car all alone and does not heed to mother request not to drive car because of her problem. Even mother feels that if you have any convulsion while driving, what will you do? She says, okay, no worry, don't worry, I will manage it. advises her mother, don't take tensions, enjoy life. Our luck is always with us, never get angry at all. Says, what is the use? What purpose does it solve? So this is what the disposition was. So by reading this point, that we are dealing with a kind of the constitutions which is very extroverted, lively, vivacious, and high-spirited kind of personality. Second, she is all driving, and she told mother that don't worry about it. That means she could be a one kind of courageous and having a positive attitude. So this is what they are. She never get angry. She told that why would be angry? No use of that things. So this is what, and what purpose does it solve? गुस्सा होने से क्या प्रॉब्लम सॉल्व हो जाएगी? नहीं होगी. So that is a positive kind of dispositions. She is not at all bothered about the attendance at college. She has one desire to earn as soon as she can so that she will be independent and people will say, yes, she is earning. So along with the graduation, she is studying computer bracing. So this is what she wanted. She is not bothered about attendance at college. So that means this constitution is not so conscientious. She just wanted to earn money early and wanted to become independent. So this is what independent become. Okay. So this is a non-conscientious type of personality. She is very lazy when at home. Only work she does is cleaning and maintaining the old classical lamps and other antique articles, which gives her excitement, and she starts imagining and thinking of the bygone era and the excitement of that time. So this is what she is. She is very lazy at work, not doing any work. She only does work, which is what the antique things she had. She cleans only that, and she got excited and she was imagining that what era was at that time and everything. So this is what she is. Doesn't like to draw or paint, but keeps on drawing broken hearts everywhere while studying. uh, while reading novels, while lazing around, she draws broken hearts. They are her trademarks on her all books. Even on doctor's inquiry, she did not give any history of disappointment in love. She reported, girls like me never love, but they are loved by others. See, this is what the ego of the personality is expressing in this way. Okay, so that is a egotism. She likes to boast. She is very haughty. I don't have any history of disappointment in love, doctor. But I'm the girl like that. Everybody loves me, na? So that is what the ego is showing. Okay, I love being me, being appreciated. She said that. I love being me, being appreciated. I care a lot for appreciation, and so I will do something different and daring to be appreciated. So this is what the process is. I don't love anybody. Okay. So this is something that there is no attachment and emotion, but this is something that indifferent to loved ones and the family. So this is what her attitude is telling us. She just wanted to show that I am doing some different and daring thing so everybody will appreciate me. So this is a dominating query, a heedless, careless query. Okay, I will see it to that people notice it. I love to advertise my quality. This is what a boster quality. I am very outspoken, frank, and hence always involved in a dispute. So this is very courageous, but this is a dominating and heedless kind of personality. I don't feel like talking to servant. So again, this shows that it is ego. Her ego is so high. They are not at my class. I talk to them only for giving orders only. So this is something you have to understand the aura and the observation of the patient when the patient is talking to you while case taking. So this is dominating and dictatorial kind of personality and having the ego and the haughtiness. Very dominating with the family and the friends, no great attachment with anybody. Her only hobby was to roam around in a car and would go driving. Even despite warnings from the parents, within hour of falling down with a fit, she would be at airport to receive somebody. So this is what you understand. This kind of constitution is very dominating, dictatorial, no attachment. So this is indifference to loved ones, and she doesn't bother about anything. In spite of having fit, she goes to the airport to receive somebody. So this is heedless. On further inquiring about the dreams, she had a dreams of adventures. I am going to a place where no one can. That place is very nice, is inaccessible. No one has to see it. There is a lot of greenery and the beauty and of a daily event. So this is what she is showing, that I am something else than the common people. Okay. So what you observe from the above history, that we have to understand what was the wheel of this personality. A timid kind of personality or a strong will personality? A strong will personality, absolutely. What is the intelligence? What is the moral? What is his basic dispositions? She is intelligent, yes. His moral is non-conscientious, yes. Haughty, so disposition is haughty, very good, great. Egoistic, non-conscientious, strong will personality, do not bother about that, yes, absolutely. Anything else? Superiority, absolutely. She is showing that superiority. Immoral, non-conscientious, haughty, heedless, absolutely. Great. Anything you have an input? So we have to look into consideration of this personality. Yes, she is a positive. Absolutely. The strong will is a positive. Absolutely. Great. Anything else? See, we have to look into consideration of the genetic constitution. So we have to look at what was the physical aspect, what was the mental aspect, what was the general aspect. Okay, now, great. So we are reading this again. So from the above history, we see a very bold, courageous, high-spirited, and haughty character, that typical spoilt college girl, a rich girl, probably pampered and hence disobedient with the hysterical ailment. What was the thing that she used to have a convulsion with the fall? So that is something that you have to understand. Hysterical. So on the basis of this hysterical and spoiled children, the first remedy prescribed was Moschus. One. After Moschus, the coryza increased, headache increased, felt more lazy in the 2 weeks, feels indifferent to dressing up, even wearing a lens, no fits, 1 to 4 days were fine. Okay. Remarks. The particulars of the headache and coryza are welcome signed as the return of original symptoms. According to Herring's law of cure. No fits. Is this also okay sign? First few days were fine, not a good sign. Indicate a partially indicate remedy, probably covering only disease factor. The point is laziness, weakness increasing. So this is what very important to understand in the follow-up, that laziness and weakness increasing. It is a bad sign, indicate the toxic condition of the constituent is not better. The toxins are not being eliminated, but are very much in the tissue and may lead to the suppression. So this is what our medicine is somewhere, and no desire to wear or dress or wear a lens, especially in such a lively girl, not at all a good sign. Okay, so desire means natural to live and enjoy and carry, express the natural genetic trait in an individual is the most important. So loss of desire and liveliness is a sign of wrong remedy. So we have to understand the love for the life, more love for the life, and no love for the life. So when there is from the love for life to the no love for the life, is that means asura going into syphilis. So this is a wrong sign. So the Moschus is the wrong remedy. Now case was reconsidered. Okay. So case was reconsidered. We have a haughty, courageous, high-spirited, loves fruit juices, chilly and thirsty, and on the basis of that, veratrum al 1m 1 dose was prescribed. So on the September 1907, Sir advised stop Tegretol stop किया, veratrum al 1m was prescribed. On 18 September, one attack lying in a bed when severe headache after fit, sleepiness after fit, and wanted to roam. I don't want to sit. So on the basis of that, sir prescribed SL, nothing to worry, mentally better, and then she developed ulcers on the left leg on a shin, warned not to apply any local application. So this was the things that from epilepsy, the patient developed ulcer on the left leg, shin of the tibia. But sir advised that not to apply anything over the skin. On November, ulceration of not leg not healed. So like almost a month is going on, and age is irregular and bleeding. It was not healing. On 15th of convulsion followed by headache, lower ulcer healing, a new one forming above it. So एक अटैक आया और अल्सर भी डेवलप हुआ नया वाला. So sir says, how did it occur? Something is that you have to inform. So mother informed us that despite scolding her, she still persisted with applying perfumes. I don't know where she hid it, but she removes it from the secret places and uses it. When I asked her about this, she said, whether you cure me or not, I am going to use it, though I get headache from it. So this is what type of personality is. So there is something happening. The convulsion आया, convulsion नहीं था 2 महीने तक और अल्सर डेवलप हुआ और अल्सर पे कुछ लगाने को मना किया था. But again ulcer also developed a new ulcer and one fit. So sir advised something is going on. So something she had applied. So mother informed that she is using a perfume daily. And what the answer of the answer of that girl? I don't know where she hid. I don't know. I'm going to use it, though I get headache or not. Okay. So she is not bothered. So she is very disobedient. Again, she hides perfume and applies so deceitful and sly, and she is not obeying the command. So she is defiant kind of personality. Okay. So now remarks. So we have to understand from this case. Okay. So on a deep inquiry, the girl confessed of having applied local ointment the ulcer to the ulcers despite of being warned against by the doctor and her parents. The fit had increased in number and intensity. The duration of the dullness and confusion after sleep had increased. This shows that the disease had not weakened nor constitution has strengthened despite exteriorization project as ulcerations on the skin of leg. A new ulcer has no business to form above the old one, indicating suppression. So, strengthening of the constitution with the help of genetic constitutional similum has to be associated with the weakening of the disease. It means in this case a reduction in the number of the feet, more alertness of the mind, less dullness, and then how do we explain the exteriorization on the skin? Then what is the use of following Harring's law corollary from inside out? So disease in the sixth layer of separation to the first layer, but there is a catch to it. The epileptic seizures are due to discharge of excessive electrical activity in the neuronal cells, as was evident in the EEG investigation. MRI did not show any abnormality. The disease was in the neuroderm, but the soric in nature. So disease after our remedy came out on the skin, but not in the soric form, but in the syphilitic form. Disease after our remedy came out on the skin, but not in the psoric form, but in the syphilitic form. It means destruction from ulcer with the bleeding and jagged edge, a travel of disease from psora to syphilis, even though in a lesser important layer of the skin, is not a journey toward the ideal cure. So, what from this case, what we have to understand that this is something is going on. So, the corollary what Sir has added is the reversal of miasm is the first key in the follow-up. So, syphilitic miasm is more dangerous if spread announces destructions, unlike SORA, which is only functional derangement. Suppose, in case the MRI had shown epilepsy arising from the lacunar infarct. See, here the MRI was absolutely normal. But if MRI shows there is a lacunar infarct, inside the brain or any other destructive process in the brain, then appearance of the ulcer on the skin with a definite improvement in the fits and general alertness would have been a welcome sign. This would have indicated change that the disease destructive process has shifted from the more important to the less important sphere. It means the skin. If fit were the outcome of the SOL, space occupying lesion in the brain, like a tumor, then exteriorizations would mean appearance of the warts or callosity or a ringworm, all psychotic on the skin. If this is further followed by boils or a rash or a mild eczematic dermatitis, it would definitely mean the process towards psoriatic miasm and hence the perfect cure, albeit with a general improvement in the stamina as explained earlier. So this has to be keep into mind when you are dealing with the case of epilepsy. You have to first categorize the epilepsy of the miasmatic background. It is because of some space occupying lesion, it is because of some infarct in the brain, or it is because of some functional changes. So if functional changes happen, it is outwardly reflected and patient is better with the generals, so it shows the functional changes at the level of ectoderm. If it is a syphilitic, then the syphilitic is a welcome sign at the ectoderm. But when the psoric convulsion you are treating and the syphilitic expressions at the level of the skin you find, then it is not the welcome sign. Naturally, in above mentioned case, the remedy was still not the genetic constitutional minimum, despite the wrong direction indicated by miasmatic chart of suppression would invariably take the girl toward the doom. The case has to be reconsidered again. Process. Tell me, what we have to thought in this case? Yes, indifferent to loved one point we have missed it. Yes,
Yes?
absolutely. Then
Nothing करणार म्हटलं थोडं खाई द्यायला एक रकाबी थोडं नाश्ता खाण नाही लागतं पण दूध नाश्ता होती
deep sleep after convulsions, yes. Want of appreciation, but want of appreciation does not give any medicines. Yes. So we have to look into consideration some syphilitic things we have missed. We have prescribed on the basis of psychotic history. Yes. Destructive nature. Explain destructive nature. What kind of defined? Yes. Audacity. Yes. We can think of audacity. Yes. Superiority. The point is indifferent to everything. Yes, absolutely great. Then, so we are reading further that firstly giving importance to the girl, the most pronounced natural undiseased characteristic. Firstly, we are giving importance to the girl's most pronounced natural undiseased characteristic, which symbolizes the girl was most important. Secondly, that nature has to be coupled with the second pronounced trait of the girl. So first rubric chosen from her is very lively, freak out, enjoyable, enthusiastic nature. So we have a broad rubric which is called as vivacious. So this is what Sir has mentioned in the genetic constitutional minimum, that you have to understand the constitution is extroverted or introverted. So your gene is expressive genes or non-expressive genes. If gene is non-expressive, we have to take into consideration the broad rubric for non-expressive. If the gene is more expressive, we have to take into consideration the more expressive rubrics. So this is a vivacious. So vivacious is the first no, expressive rubric of the extroverted kind of personality. So it has a 119 remedy. Second, selected from the following nature, she never bothered by the actions or action never restricted by her fits, always ready to go ahead in the life. Advice to mother, don't take tensions. Our luck is always with us. Always looks positive at side, never at a negative side. So this is again, so first we have understood the extroverted and introverted. Then second we have understood the will. So the will of the person is positive. So we took another rubric, the positive. Let's see, frivolous also. So, on the basis of combining this innate characteristic, the vivacious plus positive, so we have arsenic, ferrum, hepa, lachesis, mercury, and sepia. So, third rubric, as seen from her behavior of defying her parents and driving a car 1 hour after the fit, and defying me, you cure me or not, I won't leave perfume. We take the third pronouns rubric. So, this is what a syphilitic aspect of the personality defined. So by eliminating the analysis, we came to the two remedy, which is vivacious plus positive plus defined are mercury and sepia. So fourth rubric is she want to go outside, wonder desire to. So wonder desire to gives only the one remedy, Merksol. Incidentally, Merksol is a chili in a chronic disease, has increased thirst, increased perspiration, also cover the haughty, dictatorial, self-esteem, disputation, non-conscientious, and sensitive to odor of perfume. So drawing of the broken heart, probable indication of the syphilitic constitution. So with what we miss is this, you know, she said, I don't have any disappointment in my love, but I am drawing broken heart. So then whenever the drawing, so whenever you are looking into the child history, say for example, I am giving you a clue. Whenever a child is drawing something, look the drawing. So that drawing also indicate that the child mental state as well as child are in which miasm. If a child is drawing a very nature home, what we call as a sun, moon, and there is planets and everything. So this suggests that the child is in a soric state. When the child is playing with the child is drawing luxury like a car, like JCBs and everything. So this is something called as a child is in a psychotic. But when child drawing a monster, a child drawing very dirty pictures or child drawing something weird, then this is something you have to look into consideration that at the level of mind he is in a some syphilitic state. So here the syphilitic state was a drawing of broken heart. So on the basis of this, the remedy prescribed was Marxol 1N. So dispositions is there, but when we are not taking into consideration the sequence, then and then we miss something which is important in the case. So Marxol 1M was prescribed. After 1 month, the number of the feet increase, but feet lasting very short time and it is a transient. So no more sleepiness and dullness, feels more alert and freak out more. So this is what very important follow up. The fits lesser in number and intensity, confusion not more after the fit, and laziness nil. So this is very important. Even the transient increase in the fit, that suggests that this is what our brain is throwing toxin from the brain to the lower. So that means the fit is increasing. Along with that, There has to be improvement at the level of general, improvement at the level of laziness, and improvement the post-ictal phase. That means the confusion is no more after fit. The consciousness during fit. Now it is very only two in the fix. So the consciousness, awareness of the feet before they come. So this is what very important. The person understand that now I might get a feet, so I should be very cautious and alert about that. And I took a good place, so it will not bother me. So this is what a survival mechanism is working. So awareness of the feet before they came, and she was talking during the feet. So this was things happen. Now she had a headache, mild for a few days, but now it was relieved, no more fits, and she developed a skin eczema and reddish rash on the leg. No dullness and laziness. Generally better in all ways. Stop all medicine. Eczema persisted, left alone. So this is what we have to understand in this case, that what we have missed. Okay, so from Moscas, a hysterical girl, to the another remedy, Veratrum alb. From the Veratrum alb to the genetic constitutional remedy is Merck Sol. So this guide us that we have missed something in the history, and that is helping us to get the things. Okay, so we end case here, and today's discussions. Any questions? If you take frivolous, the mercury is there on frivolous also. Okay. So ultimately, when you are considering the genetic constitutions, it will took care of the many aspect and facet of that remedy in this case. As such, since I am practicing 15, 16 years, as such, I have not antedated any cases with the previous medicine which is wrong. But whenever your medicine is right, it will automatically antidote and cure will happens. One thing. Second, in case of acute disorders, which is because of certain medications, wrong medications, homeopathic wrong medications, sir probably advise sepia to be prescribed, and that will antidote the case. Second, whenever something, if wrong medicine is applied and patient goes into irritability and delirious conditions and his sensitivity got heightened, in that case, sir generally advise apply or prescribe a Tocurium marum verum, another remedy to antidote the case. I have experience of sepia in many cases where these things is happening. And the third point, when the things which is transferred from the endoderm to the other uh, layers like a mesoderms or a neuroectoderms and everything. So, for example, a case of a diarrhea, and the patient has taken a medicine after medicine for diarrhea like antibiotics and everything, and the second day the patient develop vertigo, or second day the patient develop multiple joint pain. So in that case, you have to antidote with the abrotenum. So this was the clinical experience of myself, and also sir has given this in the many cases. So this is what, as such, I have applied in my practice. But as such, if your medicine is right genetically, no need to prescribe the antidote. Yes. There should be the concept of potency is very depending upon the experience of the individuals or experience of the physicians. Sir generally use approach on the basis of single remedy, single dose, and you have to understand that. our medicines, which is potentized, is a highly dynamic in a form. Even a 200 will give a wonderful result. Up till now, since I am with the sir, so we have not seen sir using LM potency in any cases. I had not seen. Okay, or I don't, sir don't show that. So this is what we have learned. But you can apply based on your clinical experience. Okay. Asthmatic attack gone after a stramonium, patient feel better, eczema-like eruptions occur at the ankle, wait for that SL given. After 2 months, eruption remain same. Now what to do? Wait, nothing to do. Patient is curing itself. It is not a time bound that it should be go in a few months or it should be going into a particular time durations. It will take time. Okay. So wait and watch. Sir, see, I had seen sir waiting for long 2, 3, 4 hours, 4 years long, 2, 3, 4 years in cases where sir has not applied any single medicine, just SL. But now you have to counsel the patients. Okay. So in that case, can we use the relationship criteria? Every medicine has their own antidote, so can we use that? Yeah, absolutely. Most of time in antidote is can be used in the acute cases where your medicine is wrong and you have to correct it, not in the chronic cases. See, if you understand miasm in a proper sense, you don't require any medicine to be antidoted because you have to check the process of miasm with the right homeopathic medicine. If you apply the right homeopathic medicine, the correction will happen. It is what Master Hahnemann has also mentioned in one of the aphorisms that unless it is aided by the homeopathic medicines, we cannot check the miasmatic progression of the disease. So Master also know that only homeopathic medicine correct the miasmatic process. No other medications, even allopathic or other medication, can check the miasmatic progression. So when your medicine is right, you can check the miasmatic progress and no need of any antibiotic or no need of any antidote to that. Okay, itself a constitutional remedy is antidote to the previous remedy. But in case of acutes, whenever there is a change disposition happen, so in that kind, you have to use the chart of relationship. So for example, a constitution is calcarea calf. Okay, and you are treating that constitutions, and suddenly one fine day he develop a tonsillitis and the symptoms of tonsillitis leading with the violence, irritability, redness, and heat and everything, and high fever, intense fever. So, on the basis of the change dispositions, that the remedy came out to be belladonna. So, belladonna is acute of calcarea cough, so it help you in the acute conditions. Okay, but whenever you are dealing with the chronic conditions, no need to antidote. This is what I had experienced in my clinical practice. So thank you. Any questions? Thank you. Thank you so much. Tomorrow we will have a holiday. We will continue our journey from Monday to Saturday, and this will continue going on. Okay. Thank you. Thank you for being with me, and thank you for giving me food for teaching you. So that's why this motivations gives me to teach you all. Thank you. Thank you. Thank you. Thank you so much. Happy Makar Sankranti in advance to all of you. Enjoy Kite Flying Festival. Thank you.